Hi, Tim. Hi. Hello, everyone from London. I'm so pleased to be able to not only be here, but also to speak to so many people. I believe from Tim that this is probably the biggest gathering of BBS folks, the BBS community that there ever has been. So it's, first of all, an immense honor to be here, but it's also more of an honor for me to be able to share with you some of our latest information around our upcoming uh, gene therapy trial for BBS1, as Tim has mentioned. Let me just put this into a presentation mode. Right. So I'm Phil Beales. I'm co-founder and CEO of Exovia Therapeutics, which is a very small startup gene therapy company, which we spun out from UCL in order to be able to develop specifically therapies for Bardet-Biedl syndrome. So for those who know me, um, I've been passionate about Bardet-Biedl syndrome. I've been looking after patients, caring for patients and their families for the last probably 30 years now. Been involved with research, everything from gene discovery through to what do these genes actually do. And I never really thought I might live to see the day when there could be not only one, but two therapies available for, or at least to be tested, should I say, for Bardet-Biedl syndrome. And as Tim says, we're developing and we have been developing with the team the first gene therapy for BBS1. And this trial is about to start. It's called the AXIS trial. And Exovia has developed this gene replacement therapy, which is intended to halt or prevent blindness in patients with BBS secondary to faults in the BBS1 gene. It's important to know that this won't work for anyone else with any other type of gene therapy, with any other type of gene mutation, sorry, because the gene therapies are very specific to each of those. And it's important to say also that there are no existing therapies for retinal degeneration, vision loss associated with BBS1. So what is it this clinical trial is aiming to test? It's trying to determine whether or not by placing a healthy gene into the eye that it's safe and that it doesn't have any bad effects, okay? The second thing we're looking for is early signs that this treatment could help people maintain their vision by slowing down or stopping the vision loss. And so very briefly, just to remind you what gene therapy is, I'm sure a lot of you have come across this at some point, but very simply put, it gives patients a healthy version of a defective gene. So we place the gene inside a vector, which essentially is introduced into the cell that is a problem. In this case, it's the photoreceptors, the rod or the cone in the back of the eye. And the intention is to restore the cell function. And in this case, in the back of the eye, it's about restoring the possibility of a rod or a cone to transmit light and therefore images back into the brain. Now, as you know, in terms of the background, BBS is a progressive disease. Most children, if not all children, are born with good vision, but then this deteriorates. And so these photoreceptors, as I mentioned, in the retina, they do die. And most patients have completely lost most of their vision by their mid-teens. And very much as Dr. Drack has shown in mouse models, we have also shown that the data suggests by giving this gene therapy, we call it AXV101, but it's just BBS1. It's a human version of BBS1 that we give to these mice that also lose their vision. They're good models for BBS. And what we've been able to show is they can slow and halt retinal damage in these mice that would happen in the eye that is untreated compared to the treated eye. And this has really permitted or allowed us to develop this first in human full trial for Bardet-Biedl syndrome type 1. So what are the expected benefits? Well, as I mentioned already, delay and prevention in vision loss, but there is a possibility that we may see some potential vision improvement. That's not our expectation. I want to be, clear about that. But we have seen that in some other clinical trials for inherited retinal dystrophies. So we will be very interested to see whether that happens as well. So what about this gene therapy? So we have developed this healthy gene and placed it inside a vector, which is an adeno-associated virus, okay? Why are we using a virus? Because Mother Nature has invented the best entry vehicle, if you like, to deliver the payload. In this case, it's the gene, it's the BBS1 gene, into the cell, into the target cell that we're trying to get it to. And some of the key benefits of using AAVs, as they're called, are, one, they're naturally occurring and they don't cause disease in their own right. They provide long-term expression. In other words, the gene, when the gene is switched on, we expect it to stay switched on for a long time, many decades. They also have a relatively low immune response. I'll come on to that in just a minute, when injected into the back of the eye. And for not only the scientists and the doctors amongst us, but also the regulators and you as patients yourself, you'll be pleased to know that this type of gene doesn't get integrated into your DNA as such, which is an important factor when it comes to designing gene therapies. So how is the therapy given? It's given as a single dose. So literally a single bubble of the gene therapy, a minute amount, is delivered literally with a syringe through a micro needle into the back of the eye, between the photoreceptor layer and another layer of cells called the retinal pigment epithelium, or the RPE. And we want to deliver it as close to those cells that matter as possible, and in the region of the eye where there is the most fine vision that we have. And that's where all the concentration of cones and rods as well is found in the eye, around the macula and the fovea region of the eye. So as I say, this is a single one-time delivery, which we are hoping will last for life. A brief word about the risks. There are potential risks with any therapy and also with gene therapies. And these are divided into really two areas, right? There are immune reactions. There's a risk of the immune response to the capsule, the vector itself, the virus. In our case, it's called AAV9. Or to the actual BBS1 protein, because some people may not have actually who have BBS may not have actually been exposed to a normal functioning copy of the BBS1 itself that will be produced by delivering this gene into the cell that matters. So there are risks of those immune responses, but we do have methods of treating those if they happen. And like with all surgery, there are surgical risks. We would hope there will be no infections. But there are risks of, and very likely to be, inflammation at the time of delivery, but that should be very transient. And there's also a significant risk of future retinal detachment as well, because you're actually delivering this medication between two layers of cells. So you have a temporary retinal detachment, which will then seal up over the course of a few days. But then there is a future risk of that as well. So I just wanted to be clear that these things are not without risks. So what are we going to measure? Well, fundamentally, we're interested in knowing whether, one, this is safe, and two, it's tolerated not only by the eye, but the body in general. And so the way in which we understand whether this is safe and tolerable is by measuring a number of ophthalmic assessments that you particularly those of you who in the BBS community have experience of going to see your ophthalmologist, you will have had the standard group of tests, suite of tests, such as OCTs, such as ERGs, such as your visual fields and your visual acuity, looking at the letter chart, for example. So we want to measure all of those things at different stages throughout the actual trial itself. Another thing we want to be able to do is to capture any changes there may be in your quality of life, not only in your physical daily functioning as well, how you feel emotionally, how you might interact socially, for example, or, you know, does this improve your work or school? So these are really important measures to capture. So what does the actual trial design itself look like? So this is what we call an early stage or phase 1/2 study. And it will look at 2 doses of the actual medication itself in 12 patients. And those 12 participants, each of those will join the study for 2 years. They will be assessed over a period of 2 years. There'll be about 19 visits, so it's not trivial. And they will have all of those measures we mentioned a little bit earlier on done at most of those particular visits. And not only following the 2-year period, we will follow up every single participant for a following 3 years as well. So 5 years in total, to be able to get a good idea of not only the safety, but whether or not we're seeing early signs of benefit as well. So what does it take to take part? Well, there are key eligibility criteria. You need to be between 4 and 17 years of age. And you also need to have 2 confirmed mutations in the BBS1 gene for the reasons I mentioned earlier on. You also need to have signs of retinal disease, but there also has to be a relatively good level of retained retinal function, because gene therapies are good at maintaining cellular integrity and function, but they will not restore already dead cells, unfortunately. What about the trial sites? Well, this first study will take place in the UK. It's taking place in 2 hospitals here in London, Great Ormond Street Children's Hospital and St. Thomas's Hospital. And these will both be the sites for drug administration and those clinical assessments I've mentioned. The reason we've chosen these 2 centers is because already there is a high volume of BBS patients who come to national clinics, have been coming for the last 16 years now. So we have a lot of information and very comprehensive registries and clinical databases about these patients. These centers also have a significant expertise in not only subretinal surgery, but also in delivering gene therapy trials. And what we're hoping is that going forward, there will be, I'll go back to this one very briefly, that should the efficacy data show us that this is a really beneficial situation, we hope to open a larger phase 3 study, hopefully around the world, to be honest, not just based in the UK. So where are we now? Well, we've received regulatory approval back in July for this full clinical trial from the MHRA. And this follows all of the requirements around the Declaration of Helsinki. We've also received Research Ethics Committee approval as well. And we also have put together an independent data monitoring committee, which will have oversight and review all the safety and efficacy data that come out from the trial itself. And those who do take part will obviously take part with fully informed consent, and those participants are able to withdraw any time from this trial without consequence as well. Data protection is absolutely fundamental, and confidentiality is absolutely paramount as well. And we've already appointed a research organization that will run this trial. And the trial will be kicking off this fall. I can't give you the exact date yet. That's yet to be fixed, but it's coming up very, very soon. And recruitment will be via those two sites, and obviously for those patients who meet the eligibility criteria. So it leaves me really just to thank all of the people who have been involved, in particular, working very closely with BBS UK, Tonya, Angela, all the team there as well, to help design this trial and get us over the line. I also want to pay huge thanks to A Race Against Blindness, and particularly to Steve and Christina Johnston, who have helped to fund this trial. It would not be here today if it was not for their continued unwavering support for moving forward in this direction, and to ALSA Ventures as well for funding Axovia Therapeutics. So for me, this has been an amazing journey, and it's such an exciting time to be able to share with you what is just the beginning, I hope, of another journey, which with time we'll be obviously be able to share with you the advances going forward. So thank you very much for your attention.